Hey everyone! Today I'm diving into a topic that's super important but not always talked about, ventricular septal defects or VSD. So what exactly is a VSD? Well, it's a condition where you're born with a hole in the wall separating the two lower chambers of your heart. Now, your heart has 4 chambers, and they need to seal shut to pump blood efficiently. A VSD is like a leak that disrupts this efficient pumping. Normally, the right ventricle pumps oxygen-poor blood to the lungs, and the left ventricle pumps oxygen-rich blood to the rest of your body. But with a VSD, blood flows from the left to the right ventricle, mixing oxygen-rich and oxygen-poor blood. This means extra blood ends up in the lungs, which can cause some serious problems. VSD is the most common congenital heart defect, affecting about 1/3 of all newborns. It's slightly more likely in premature babies and those with certain genetic conditions. Sometimes a heart attack in adults can even cause a VSD, which is called a ventricular septal rupture. So how would you know if a baby has VSD? Infants with a VSD might have symptoms like shortness of breath, sweating during feeding, fatigue, poor weight gain, rapid heart rate, and frequent respiratory infections. A doctor can usually diagnose a VSD with a physical exam and imaging tests like an echocardiogram. The good news? Most VSDs are small and close on their own by age 6. In these cases, doctors typically recommend monitoring rather than surgery. But for larger VSDs, surgical repair or a transcatheter procedure might be necessary. Medications can also help manage symptoms. Interestingly, about 90% of VSDs close on their own by age 6, and most of the remaining ones will close by age 20. However, if a VSD persists into adulthood, it's not likely to close on its own and may need intervention. So, have you ever heard of VSD before? Share your thoughts and experiences in the comments below. Thanks for watching, and don't forget to like and subscribe for more health insights.